Go.
I was diagnosed with lupus in 2006. At the time, I didn't know what that meant. The only thing my 7-year-old mind could comprehend about lupus was that it hurt and that for some reason groups of doctors would pick and mess with my face every time I had an appointment. Of course, now I understand that they were just sampling and documenting. Something that always bothers me about the disease is how unknown it is. Despite the fact that this disease has affected millions of lives, very few people who have met actually know what lupus is. Lupus is an incurable and non-contagious autoimmune disease that can harm any part of the body and has many different stages of severity. Although lupus can make the body more vulnerable to other diseases, lupus is not related to any other disease. As a lupus patient of 12 years, I have experienced the symptoms of the disease and the many ways that people can react when I explain that I have it. It's important to me that people learn the facts about lupus because it's frequently misunderstood. At the very least, I want to inform the people in this room about lupus. I'm going to teach you about the 4 different types of lupus: systematic lupus, cutaneous lupus, drug-induced lupus, and neonatal lupus. I will also discuss the symptoms and treatments as well as what it's like to be a lupus patient. The 4 different types of lupus are systematic lupus, cutaneous lupus, drug-induced lupus, and neonatal lupus. Systematic lupus is the most common form. Its damage can vary from mild to severe, and it can create inflammation in the vital organs and eventually organ failure. It can also create inflammation in the nervous system and brain, which can cause memory problems and seizures. Cutaneous lupus only affects the skin, but it can be anywhere in the body that has skin. It causes discoid and malar rashes, and discoid rashes are scaly and red but not itchy. A malar or butterfly rash is signified by a rash that spreads across the face from cheek to cheek. These rashes are the reason that people tend to believe that lupus is contagious. Cutaneous lupus can cause hair loss and changes in skin pigment. Sunlight makes it worse because the UV rays will alter the lupus patient's DNA. This can make the cutaneous lupus turn into systematic lupus. According to the Lupus Foundation of America, 10% of people with cutaneous lupus will develop systematic lupus. Drug-induced lupus is lupus-like, but it is not true lupus. It is caused by certain prescription drugs such as hydralazine and isoniazid. It will exhibit symptoms like systematic lupus, but these symptoms will disappear within 6 months after stopping the prescription. Neonatal lupus is also not a true form of lupus. It's extremely rare, and it affects the infants of women who have lupus. It is caused by the mother's antibodies that attack the infant in the womb. At birth, the infant will exhibit a skin rash, liver problems, and a low blood cell count. For most babies, these symptoms will entirely disappear after several months and won't reoccur. However, 20% of these babies may develop lupus later in life. Now that I've covered the different types of lupus, I want to explain the plethora of symptoms and treatments that nearly every lupus patient will experience at one time or another. The severity of the lupus symptoms can fluctuate from being almost unnoticeable to life-threatening. No matter what lupus a patient has, they will experience one or more of these lupus symptoms. Thankfully, there are also many treatments available for lupus patients. The symptoms that patients will most frequently experience are rashes that are caused by the sun, arthritic pain, which gives fatigue and swelling of the joints, weight and hair loss, a low blood cell count, and positive antinuclear antibodies, which basically turn your immune system against you. These are the symptoms. There are other symptoms that are less frequent, such as susceptibility to fevers, blood clots, anemia that comes and goes, poor circulation to the fingers and toes during cold weather, seizures, inflammation of the kidneys, lungs, and heart, and the chances of having a miscarriage are much greater for a lupus patient. Lupus treatment. There are many problems that come along with lupus, but there are also many simple treatments. Anti-inflammatory drugs like Motrin are commonly prescribed to decrease arthritic symptoms like swelling of the joints and inflammation of the heart and lungs. There is also an anti-malarial drug called hydroxychloroquine that I personally consider to be equal to magic because of how wonderful it worked in my case. This medicine treats the lupus rashes and the arthritic symptoms. One downside of this medicine is that it can cause damage to your vision and it can cause blindness in extreme cases. Corticosteroids and immune suppressants such as prednisone are prescribed for life-threatening cases. It is essential to avoid stress and learn relaxation methods. Lupus flares are not only triggered by the sun, but they are also ignited by stress. Lupus loves when the patient is stressed because that's when it flourishes. It is key for the patient to be relaxed and to understand that it is one of the best ways of managing symptoms. The symptoms and treatments of lupus vary from person to person. Every case is unique. Some people may have severe symptoms during the early stages of their diagnosis, and some may have symptoms that are simply bothersome. Now I want to discuss how lupus has affected my life, how drastically it has changed over these 12 years, and how it can affect life decisions. When I was first diagnosed, I had rashes all over my face and ears. This lasted until 2013, which is when my lupus decided to spontaneously alleviate itself. I still have it, of course, but all it really causes now is fatigue and hair loss. There's always a chance that my lupus will worsen, but for now it's calm. Other patients may have a worse or better situation. Women with lupus may decide to try and get pregnant. This is very controversial due to the contradicting results that doctors have gathered when studying pregnant lupus patients. Being a lupus patient can be strange because it takes a serious toll on my health, but it does so randomly. One day I will feel healthy and the next day I will feel extremely fatigued. I have only ever met one other person with lupus, and the severity of hers was much worse than mine. I do not consider lupus to control my life because my lupus is currently in a stagnant stage. When I was a kid, I had spontaneous and severe arthritic symptoms that caused pain in my joints. I had the malar rash on my face, the discoid rash on my ears and arms, and I would wear protective clothing to defend myself from the sun. As a little girl, the disease was emotionally painful for me because it was difficult to make friends since I was so different. Hydroxychloroquine was my magical pill that made my flares go away, and after 10 years of taking it, my doctors permitted me to cease it because my lupus became calm. Nowadays, I don't need to wear protective clothing, and I don't take any medicine for my lupus. The only lupus symptoms that I have now are fatigue, weight loss, and hair loss. That's why I have super thin hair. I am very lucky that my lupus became easy to care for. It used to completely control my life, and now I sometimes forget that I even have it. If lupus was a person, it would be sexist, because according to the Kennedy Institute of Rheumatology, lupus is 9 times more common in women than men. Becoming pregnant can be a problem if you have lupus. This is because antiphospholipid antibodies are present in 33% of women with lupus. These antibodies attack the normal proteins present in the blood of the veins and arteries, and they are the reason that miscarriages are so common in women with lupus. There are many opinions about pregnancy and lupus. I have had doctors tell me that it is perfectly safe for me to have a baby one day, but I've also had doctors tell me that it's incredibly dangerous for me and the fetus. According to the National Organization for Rare Diseases, 20% of babies who are born with neonatal lupus will be diagnosed with cutaneous lupus when they grow up. The Organization of Teratology Information estimates that the risk of miscarrying is 35% higher for women with lupus than for women without it. Many prescriptions for lupus are also harmful to the baby. It is possible to have a healthy pregnancy and a healthy baby. However, there is always the chance that something could go wrong in the case of a pregnant lupus patient. This is the reason that many lupus patients adopt or don't have children. Lupus affects the patient's health and mindset when making major decisions. While lupus is incurable, it is treatable. It is possible to control the lupus through medication, support, protection from the sun, and relaxation. These 4 solutions can contribute to keeping the patient healthy. There is no known cause or cure for lupus. There are theories that genes and UV rays likely contribute to the development of the disease. A mother can give her baby lupus through birth, but there are also cases like mine where there is no lupus in my family history. I was diagnosed when I was 7. This was bizarre at the time because kids wouldn't get lupus. 80% of people diagnosed between the ages of 15 to 45, so a child getting lupus was extremely rare. And only 12 years later, more children are being diagnosed with lupus. But typically, the age demographic of 15 to 45 is when people are diagnosed. I used to call my lupus rashes owies. I didn't understand what was happening in my body, and at one point when I was little, I thought that I was contagious because that's what other kids would tell me. Now I understand lupus. I understand the 4 different types, the symptoms and treatments, and the many ways that lupus can exhibit itself to each patient. I am glad that I've discussed lupus with you, and I hope that I've passed on some knowledge.